We would advise the public not to self-medicate.
Okay.
Yeah.
Especially a tendency again of the public because of embarrassment in seeking consultation
Yes.
is that they self-medicate themselves too long with antibiotics, thinking that it will disappear. Sometimes the symptoms get reduced, the inflammation subsides with antibiotics, but very rarely do they get cured permanently just with antibiotic treatment.
And you might be drinking the wrong type of antibiotics by self-medication. So you need to really see a doctor.
Your colorectal
Yes,
surgeon
yes,
for that
yes,
matter.
yes.
Doctors, let's now talk about anal warts. Is this common? How do they develop? Dr.
Anal
Arman?
warts are still not as common as the first three diseases that we have discussed. But again, in my practice, I am seeing this more frequently now compared to 5 or 10 years ago.
Why is
Anal
this?
warts, well, definitely, majority of this, if not all, is really sexually transmitted. The main cause is actually HPV virus. And this HPV virus is the one that produces the symptoms.
It's similar to your cervical warts.
So
It's
it's
the
a
same.
form of genital wart.
Yes,
Yes.
it's a genital wart.
Genital warts or anal
Okay.
warts just have really one cause, the HPV virus.
Human papilloma
Yeah,
virus.
This is the one that also leads to cervical cancer as well.
So why do they form in that area? And what are they like? They're like skin tags. Are they?
Almost like that, but they can coalesce, they can group together that they look like cauliflowers, they can look huge.
Can
Some
they
of them are
mimic
just
as
small,
a hemorrhoid? No.
Well, to an expert eye, they don't look like hemorrhoids.
Okay.
And you know, many of these people know they have a history.
Okay. Sorry, doctor, you were saying earlier.
Yeah, some of these are just very small lesions, but some of them can be really very large, almost looking like the vegetable cauliflower.
Oh, okay. So it's not like the warts that we normally see
No.
like a dot or like a skin tag.
No, they group together and they grow faster. They grow faster. In fact, one of our difficulties with this problem is they
Yes.
can recur. Even if we treat them, they have a tendency to recur.
Okay.
Or they have a tendency to get reinfected with their partners again. So it's a little more complex in treating.
We have to treat these patients rather holistically. But at least now, I think compared to before, many of our patients used to be embarrassed in admitting their sexual preferences. But now they're more open.
Yeah.
And we're able to advise them properly because of that. So aside from treating them either symptomatically or sometimes we apply some chemicals to sort of cauterize, or we actually surgically cauterize large lesions, or we have to excise the really very large lesions, we really advise them to really abstain from anoreceptive intercourse and of course practice more hygienic sexual practices as well.
The other issue with warts is because it's a sexually transmitted disease, there may be also other sexually transmitted disease like gonorrhea, syphilis,
Yes.
and then
Even
also HIV, which is also growing in this country. And so that's a big issue that we will be grappling with more and more in the future.
Okay, so it's the statistic that you mentioned earlier that you noticed the last five
The last
years,
5 to 10
it has
years,
increased.
I'm seeing really more patients.
When we were training in PGH
Yes.
many years ago,
Just a couple of years ago.
a couple of years ago, maybe we would see one a month. Now we're seeing 3 a week
Wow.
Yeah.
in our charity services. So that's how fast they've
Yeah,
grown.
our lifestyles as a country really has changed. That's why I always tell my patients, even if I'm able to remove or cauterize your warts, I'm not able to eradicate the virus. The virus actually really stays there.
Okay, so you just cauterize the wart.
What we see.
What you see.
What
you
you see.
take it out
Yes.
via surgery or cautery.
But the virus essentially remains in that area so that when your resistance goes down, you can have recurrence of these warts again.
The other thing is, just like cervical warts that
Yes.
can cause cervical cancer,
Yes,
Long-standing anal warts can cause anal cancer.
yes, in the long run.
Yeah.
So aside from taking that out, you
You need to monitor them.
need to
We need to
monitor,
monitor
and
them.
you should not feed that virus, no? When you're resistant, is that
Yeah.
did I say that correctly or properly? That when you're you know your resistance is down.
Well, you need to
then-
be monitored.
You need to be monitored, you need to change your lifestyle, and really improve on your immune system through good nutrition, being physically fit, exercising.
And safe sex.
and safe sex, and see your doctor, no?
Yes.
Yes.
How often should one see their colorectal surgeon?
For warts, it
Yes.
depends, but we see them weekly for the first 6 weeks of treatment, and then maybe monthly for the first 6 months, and then every 3 months.
Okay.
We have other things. Sometimes we give these immunization against HPV also.
Oh, okay.
We
There's
have
that
creams that
vaccine
we
also.
apply. Yeah.
All right. Doctors, to learn more about, being more careful about our general well-being and the rectum and anus, no, for this particular episode. I understand March is devoted to
Colorectal Cancer Awareness Month. It's the International Month for Colorectal Cancer Awareness. I'm wearing my
Blue ribbon.
ribbon.
I didn't mean to cut you there, but we'll talk about Colorectal Cancer Awareness Month. It's this March when MedTalk returns.
If your bottom appears to be itchy and irritated, you may want to lessen the amount of drinks you normally consume in a day. According to the American Society of Colon and Rectal Surgeons, avoid having more than 6 glasses of alcohol, coffee, or any carbonated drink in a day.